Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about how to treat a tricep tendonitis. But before I continue, please hit that subscribe button below so you'll be notified about any new videos that I have here on my channel. So essentially, tricep tendonitis is tendonitis of the tricep tendon, which runs from the tricep muscle here to the olecranon process, which is essentially a bone off of your elbow. And this tendon can become inflamed typically with an eccentric contraction where you are pushing off, right? So when the elbow is going into extension. So you'll see this sometimes. I've had patients where they tend to get out of bed in the same way, where they're kind of pushing off on that same arm continuously, or it might be due to a pushing up type of action where there's maybe a heavy box that you're pushing up against, or anything that really involves, again, quick extension outwards on the elbow. And so what'll happen is the insertion point right on that olecranon bone will become very painful, and it'll be painful again with any of these sort of resisted type of movements. And so typically what you want to do is, number one, you want to avoid those activities that cause that pain initially, right? So where there's a large amount of weight, and again, we're pushing off against that particular item. The other thing you can do is actually ice that insertion point area. So ice massage, for example, so taking an ice cube and basically massaging right along that area. What I like to do too is actually some self-massage directly on the tricep muscle. So what that would involve is actually using perhaps a tennis ball and then going right up against the wall and just finding those really tender points and again, doing your own self-massage. If it's pain-free, you can actually go into a tricep stretch. So again, you can use your other arm and basically bend the elbow and go into some shoulder flexion back. You can use actually the wall as well to do this type of stretch and just lean into it. But again, we want to make sure you're not putting any pressure directly on the olecranon process and it's not causing any pain. So again, in this instance, you would just lean into this and hold for a good 30 seconds or so. The other thing that you can do, especially at the acute stage, is there is actually a brace for tricep tendonitis, and essentially the brace would put direct pressure on the tendon, which reduces the pull directly on the bone, which is what's painful. So that should minimize the pain with day-to-day activities that, again, where we might be doing lots of elbow extensions. So you'd want to wear the brace when you're going to be doing that action. So that might look like, if you have to do any sort of reaching above, if it's sort of job related, maybe you're doing some groceries and it involves, again, sort of extending out the arm in that sort of action. So we want to minimize the direct pull on the bone during the acute stage. Now, as things start settling down, you actually want to work towards some strengthening activities. And so I tend to start off by having the patient do what's referred to as isometric contraction. So what that would look like is, I'm just going to use my other hand. So let's assume it's the right side that's in pain, and I'm doing a gentle resistance into, right, elbow extension. So you can start in this angle. I'm going to hold for a few seconds and then relax. I'm going to hold for a few seconds and relax. So I'm activating the tricep, but I'm not going into pain, and I'm monitoring the intensity of the push. From there, I like to go into a multiple angle isometric. So you might start off at 90 degrees, right? Gentle push and relax. And then maybe I'm going to go into, again, more extension, or maybe I'm going to go into a deeper right flex position. But the whole idea is I'm not going into pain. I'm starting out at a very low intensity, and then I'm increasing the resistance, and I'm, again, monitoring myself in terms of pain. From there, I would go into some movement with resistance. So this might include some sort of band work, so resistant band, TheraBand work. And so now, and I don't have one with me right now, but let's assume I'm holding on to a resistance band, and then I'm actually going into, right, full extension. I would go from a concentric contraction, which is essentially an even amount of extension to flexion ratio, to then an eccentric contraction where I'm going to go quickly into extension, then slow into flexion. And again, I'd maybe be, if you can imagine, I'm holding the band here, I'm going into fast extension, slow flexion back. Fast extension, slow flexion back. From there, then I might work on weight-bearing specific exercises. So again, things like push-up type positions. If you work out, doing bench press, these type of things will be painful initially. So you want to work towards the ability to weight bear through that. So that might also look like eventually just a simple wall push-up, right? As a starting point, seeing how the tricep responds to that. And in a lot of cases, right, when I'm including body weight or even the band work that we talked about, I would have the patient wear a brace initially to offload the pull, right, on the insertion point, and then wean off the brace as pain allows and as the strength improves. So again, you want to work towards building up the strength and tolerance, but in a very gentle way, and you consistently want to look towards minimizing pain when you're increasing the amount of weight that's going through there. Again, you can also do the icing after doing these activities, or icing at the end of the day if it gets provoked at all. And you can actually warm up the tricep area by putting some heat or a warm shower first initially, especially before doing any sort of stretching and things of that nature. The last thing I forgot to mention too, especially this is great during the acute stage of healing, is you can actually do a little bit of self-massage, which are called frictions, directly on the tendon. So not on the insertion point, but where the tendon, sort of around that area where it attaches onto the muscle, you would put some pressure in sort of a perpendicular position across the tendon. And for that, again, you want to, and this is the one time when a little bit of discomfort's okay, but typically you'd want to go for about 2 minutes with that particular exercise. If you have any questions or concerns, feel free to leave a comment below. And thanks again for watching. Make sure to check with a physiotherapist to make sure that this exercise is appropriate for you. Have a great day and take care.